At Aetna, we say, you don't join us, we join you. And part of our strategy is looking at how we do that with our provider partners as well. Because many of our members, they're the most vulnerable, complex members in the population. How can we collaborate, support, and complement what they're doing? And that's really a very important piece of what we're doing with population health.
Aetna Better Health, in collaboration with Lakeland Care Network and PCC Wellness, is making a difference through their population health management program by decreasing emergency department and inpatient utilization and improving follow-up rates after hospitalization.
We do our best to help providers improve the health of a population, and often that means starting at the individual level. We're a facilitator, and we bring together data and technology and people.
The collaboration is essential for the member. The payer can provide information, the health center provides the care, but the most important component is the outcomes that we see for the patient. There are resources that Aetna has that PCC does not, and vice versa. And so the ability to collaborate in that way really just increases opportunity for the patient to have all of their health addressed at one time.
The big things that we provide are really the data and analytics, helping them understand who are my high-risk members, who needs an outreach for gaps in care, what subpopulations need support and help in a different way than maybe the general population.
One way we can take this data and make it most actionable is
they had an extremely helpful, knowledgeable, robust population health team that they assigned us to work with.
They have what we call boots on the ground. People who are here that are forming those relationships with the patients.
The collaboration that happened between our organization and Aetna was unlike anything we've really seen with the health plan. It often feels very sterile, very much like a business relationship, and this truly felt like more of a genuine partnership.
It's been really fun. It really has, to see what potential this collaboration has.
In 2017, Aetna Better Health of Michigan and Lakeland Care Network's dual-eligible transition of care program was recognized by the Institute for Medicaid Innovation as a managed care best practice. Outcomes from the program as of December 2017 include an astounding 33% reduction in 30-day readmissions.
Our population health program is striving to really break through the barriers of that relationship with our provider partners and be viewed internally within their organization as an asset.
Let's talk about value-based contracting. I need to demonstrate that I can reduce the cost of healthcare and that I can provide quality healthcare at the same time. Aetna came forward and they gave us a tool. They gave us a process, and that they worked with us. That's what made us excited and why we engaged.
The other piece that we bring is our Care Unified Population Health Management tool. And the tool is really designed to give actionable data and information for the providers at their fingertips that complements their electronic health record, because there's still a lot of data that sits outside of their four walls that they don't have access to.
Care Unify was the platform. What it really did was break down the silos that we had previously been working in and allowed us to get the bigger picture of what was really going on with this patient, and ultimately then allows us to provide better care for our patients.
We're looking at social determinants of health, housing, caregiver, food, knowledge.
The tool that Aetna developed for population health is a tool that helps me enact my strategy. It helps me identify those patients that are at high risk, those patients who aren't engaged, ultimately creating a healthier group of patients for PCC.
If we want to truly transform healthcare, we need to do it together. And that's what Aetna's Population Health Management Program is striving to achieve, is partnership with our providers so that we can best meet the needs of the patients.
We're going to see this model being used a lot more frequently and with a much greater population than the population that we're just working with today.
If this is the model of the future, then we're definitely moving in the right direction.
I think other organizations really need to think about adopting this kind of model.
When we place the patient at the center of the collaboration, we see improved health outcomes.
Learn more at aetna.careunify.com.